I was greeted at the entrance by one of the intensive care registrars. I asked him immediately what things had been like. He replied, I'll never forget, he replied, it's been like a terrorist attack every day since this started, and we don't know when the attacks are going to stop. And I remember thinking that's, you know, for them, that wasn't a hyperbolic statement. They'd admitted an average of 8 intensive care patients per day during the whole of that period. It's one of those things that is really very difficult to capture in figures. The scale of death experienced by the intensive care teams during COVID was unlike anything they had ever seen before. They're no strangers to death. They are the intensive care unit. They look after some of the sickest patients in the hospital. But the scale of death was truly, truly astounding. I went into this and other hospitals where they said it would be routine to see 3 to 5 deaths a day. I worked on a shift where we had 6 deaths in a single shift. Another hospital told us that they had 10 deaths in a shift, 2 of whom were their own staff. We had nurses talking about patients raining from the sky, where the nurses said that one of the nurses told me that they just got tired of putting people in body bags. Now, the hospital, where they said that sometimes they were so overwhelmed that they were putting patients in body bags, lifting them from the bed, putting them on the floor, putting another patient in that bed straight away because there wasn't time. We went to another unit where things got so bad, they were so short of resource that they ran out of body bags, and they were instead issued with 9-foot clear plastic sacks and cable ties. And those nurses talk about being really traumatized by that because they had recurring nightmares about feeling like they were just throwing bodies away. These people are used to seeing death, but not on that scale and not like that. And whatever the figures show you, the experience for them was indescribable. And when we talk about capacity in healthcare systems, you know, the toll on those teams from that scale, and it really was like nothing else I have ever seen, and certainly not like nothing else those teams had ever seen.